disruptive.
America that I fought for.
Weird thing to happen.
Hey, remember 5 years ago? Remember 5 years ago when mandatory medical experimentation injections, was forced upon Canadians? I know politicians would like to turn that around and say, we didn't force people. We didn't exactly, take people and threw them into a chair and injected them against their will. But you weren't allowed to see grandma. You weren't allowed to go to the club. You weren't allowed to go out and interact with the general public unless you go through this. And a lot of people 5 years ago were complacent of doing that because they were scared. They didn't know what was going on. At one point, I was scared. I didn't know what was going on at the start. But then I started looking into things. Once I got, injured, I had my shoulder severely hurt. I started looking into things, and I realized that there was a whole scam. There was a whole catastrophe coming our way, that this was more than just a virus, that this was a full-on manufactured event from the get-go to make us complacent, that this was tyranny and fascism in disguise of a medical emergency. Well, guess what? 5 years later, it's happening again, folks. Have we learned nothing? So, according to CTV News, this is literally from 2025, May 29th. So, just recently, CTV News says a majority of Canadians want mandatory childhood vaccinations, less support in Alberta, according to a new survey. What happened to my body, my choice? What happened to that? What happened to parents get the ultimate decide? I thought we're supposed to be family strong. I thought parents were supposed to, protect their kids. I thought it was the parents' responsibility. I thought patients get the last result. But apparently, that's gone out the window since COVID, and now it's being reushered again. So, a new poll suggests nearly 70% of Canadians support mandatory childhood vaccinations. The Angus Reid Institute survey comes as measles outbreak touches several provinces, primarily infecting unvaccinated infants, kids, and teens. So, to bring this to attention, because measles are the new scare. Remember, it started as COVID, then it was monkeypox, then it was bird flu. That's why they had to kill chickens and beef. Not pigeons, not seagulls, not they killed ostriches. They killed ostriches in BC, but surprisingly, it only affected beef and chicken, the top two proteins that human beings eat. Interesting. Now it's measles. The thing that they used to laugh about in 70s sitcoms. Kids who used to jump for glee about getting the measles. They would stay at home. It's a great day to get measles. He said pox parties, for God's sakes. Now all of a sudden, it's become an emergency. The poll, about almost 1,700 Canadians, found that 69% of respondents between May 20th and the 23rd said proof of immunization should be required for kids to attend daycare and school. That statistic was slightly lower in Alberta at 60%, but higher than the 48% of Albertans who supported a mandate last year. Last week, Ontario reported nearly 1,800 measles cases had emerged since the outbreak began in October. Alberta reportedly had 628 cases on Wednesday. The polling industry's professional body, the Canadian Research Insights Council, says online surveys cannot be assigned a margin of error because they do not randomly sample the population. The poll found 37% of respondents in Alberta said they had no confidence in their provincial government's response to the measles, while 30% said the same in Saskatchewan and 27% said in Ontario. A Canadian Journal of Public Health article published in October 2024 found approximately 76% of 7-year-olds were vaccinated against measles in 2023, down from just over 86% in 2019. So, it's just amazing. It's just amazing. And as someone that I'm not anti-vax, as some people would argue, some people would smear me as, when I started questioning about COVID, and I still question COVID because of how impactful the injections really came to people. But I'm not anti-vax. I am for information. I am for patience. I am for really the choice of people, that as individuals, and especially in this case, your child, a child is the responsibility of a parent or a guardian. That's how it should be. How it should be. And it's the parent or guardian's responsibility to read up on these issues, and for the public health sector to inform people. They can say what they want about, whether it's good or bad, the vaccine whatsoever, but you're supposed to release all the information out to the general public so that the general public gets a sense of what these injections are, what the vaccines are, what sources they can get, if they can get a second opinion, if there's natural alternatives. They need to get all the information out so that they're aware of all the information so they can make a comprehensive decision based on themselves. Because you as a patient always have the final say. Doctors can recommend whatever they want, but you as a patient get the final say about your health. It's your body and it's your choice, which ironically, no one says anymore. No one says anymore. Once COVID happened, once we had mandatory vaccines and mandatory restrictions, no one talked about my body, my choice. Even the people that were saying it for abortion, now they'd say that they're pro-abortion, which nobody's pro-abortion. That's awful. That's awful. That's like saying you're pro self-deletion. You know what I mean? That's awful. So the reason that the mainstream media here in Canada is reporting all this is because news came out of America. And because America has RFK Jr. as the health secretary and Health and Human Services, they released this. So it says, today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Bottom line, it's common sense and it's good science. We are now one step closer to realizing the President of the United States promise to make America healthy again. So, news broke out in America that RFK Jr., Dr. J. Butch, that's the guy on his right there, who's the head of the CDC, well-renowned physician from Stanford, and the guy on the left there, Makary, I think that's his name, Makary, on the left there. They all came together. They all went through the science and data analysis, and they made a conscious decision that they're not going to recommend pregnant women to get this experimental vaccine. And that's because comprehensive study after the mandates, the first mandates of COVID, where pregnant women and young children are now experiencing adverse side effects more than ever before. So they're taking that data, they're taking that analysis, and they're bringing it to the table to say, maybe it's not good to inject people with this experimentation that has numerous amount of chemicals that could do erupted damage to newborns, to pregnant people, to young children. That maybe we shouldn't be recommending this to people without actually consultation, which should be the case across the board. Should be a case across the board. But since we're run by the pharmaceutical industry, it's never going to reach that point. It's never going to reach that point. So that's why the Canadian media, because it seems like anything America does is bad and anything that Canada does is good, thanks to Elbows Up, they write articles like this. So the Globe and Mail, Canadian doctors continue to recommend COVID-19 vaccinations for pregnant people, countering U.S. policy change. As recommended by who? Recommended by who? The pharmaceutical industry that's profiting off this? The great scientists that say trust the science? the leading experts that can't even tell you that there's pregnant women. They don't even know what a woman is, but they're recommending COVID-19 vaccinations for pregnant women. And they say pregnant people, but pregnant women. They're still recommending it, even though the science, even though the data analysis and actual studies have proven that there's harmful effects to injecting pregnant women with this concoction. There's been countless studies. There's been countless atrocities that affect newborn babies, that affect women with pregnancy, that affect young children, people with adverse side effects. Again, I got injured. That's how I started looking into COVID. And I'm not going to silence about COVID because of how impactful it is for society, because of how much damage it's done to people, how much damage it's done to businesses, how much damage is done to society, to people's mindset. It corrupted people. It corroded people's brains so much that I've lost friends, that people despise me, that, there's still hatred on the street. It permanently divided and scarred human civilization. That's why I'm not going to give up on talking about COVID. Just how sinister it was. So, even the Toronto this is the Toronto Sun. COVID vaccine strongly recommended during pregnancy, according to Canadian doctors. Strongly recommended. It just seems like anything America does, we have to do the opposite. Because that's what a good Canadian does. We don't learn from what America's doing, take that into our own research, and make our own decisions. No, it's anything that's against America. That's what the whole elbows up movement taught us. Anything against America is good. Even if America is on the right side of this. Even if America is actually doing something correct. We have to be the opposite. We have to be the opposite because we're Canadians. Elbows up. So, here, for example, this is from the National Citizens Inquiry. So you remember they had this coalition of people gathered together to talk about how the media propagandized people, how the doctors and nurses were silenced out of the conversation, how they disregarded numerous facts and studies that prove otherwise against the narrative that they were promoting during COVID. So this is the coalition that really brought accountability to Canada. And it's sad. It's sad that this is the closest we're ever going to get to accountability. Because at least in America, you had the testimonies of Anthony Fauci. You had the testimonies of people at the helm in response of COVID, in response to the mandates. You at least got to see that. But the overall factor is no one's going to be held account. Anthony Fauci is not going to be prosecuted. Theresa Tam here is not going to be prosecuted. Nobody's ever going to be held to a contempt on the heinous actions they have done to the human race. None of these people. None of them. But we can get tidbits here and there of little information what we can get. So National Citizens Inquiry did this study where it says confusions over spontaneous abortion and death data raises questions. The Liberal platform still pushes mandatory vaccinations for travelers and federal workers, hidden government funding in CBC's income, and pharma influence on media highlight major transparency issues. So we know that the CBC, CTV, Global, City News, the National Post, the Toronto Star, all these institutions, all these outlets were pushing the same agenda because they were getting government funding, they were subsidized by the government, and they also had their biggest advertisers was pharmaceuticals. So this is a mafia crouching onto the media to push this narrative, to keep people in the dark, to control people. Just like Theresa Tam said in 2010, predicting that in 10 years' time, she predicted that there was going to be a pandemic, that we're going to test how Canadians will react if we put mandatory restrictions on people, how they were going to cooperate, how they were going to comply to medical tyranny. That's what Theresa Tam was predicting. And they never hold her to account on that. No politician, nowhere have they hold account to Theresa Tam, even just for that. Predicting this pandemic, that's creepy. That's disgusting. So here's National Census Inquiry. I'm not going to show all of this because it's a bit of a lengthy video, but here's just a bit of it.
My question there is, and you may not know the answer, but under pregnancy outcomes, it says spontaneous abortions, 87. And then it's got deaths, 427. Are the 87 deaths of the babies in the mother's tummies not included in the 427?
I don't know that, and the reason is this is not an easy website to navigate. So
just to show here, this is the Government of Canada website. This is them tracking the amount of deaths of individuals from post-vaccination. This is available on the Government of Canada website. And they said post-vaccination, you could see that the death count at that time, I believe this is from 2023, so this is 2 years ago, was at 427. 427 people post-vaccination. Pregnancy outcomes. Fatal growth restriction at 5. Spontaneous abortions at 87. Spontaneous. That's how they're wording it. Spontaneous. Oh, by accident. We may have killed your baby. We may have killed the child growing inside of you. That's how they're characterizing this in the Government of Canada. Again, not brought to justice, not brought to account. You think this would be top page news. You think this would be top page news in the country that, hey, pregnant women are having spontaneous abortions. And they're not going to Planned Parenthood for this. This is from health officials in the Government of Canada.
127. Are the 87 deaths of the babies in the mother's tummies not included in the 427?
I don't know that, and the reason is this is not an easy website to navigate. So the information is there, but it is more than likely intentionally obfuscated by you have to go through link to link to link to link. So there is something under deaths, and it says 427. And more than likely, you will be able to find if they are included or if they are an additional.
So what he's saying there is that because they hide these reports, they do this intentionally, they hide the reports. It's on their website. For, I guess, legal purposes, they have to put it on their website, but they hide it through link after link after link that people are reluctant to actually look at this information. That's how they do this. That's how they manipulate people. Just like how newspapers, if you want to read the truth about the New York Times, they may say a bit of the truth, but it's on page 87 upside down next to the word jumble. They will never tell you the truth on the front page. They want to lie to you. They have to manufacture a narrative to promote an agenda. In this case, the agenda was mass vaccinations. The agenda was to push mandatory mandates onto people, onto pregnant women. Even knowing that this information was out to the general public, that anyone could access, but it was hard to access. They did it intentionally to try to hide away from the general public. But they kept it on their website for legal purposes, because if anyone challenges them on this, they'll say, well, it was on the Government of Canada website. We had the information there. You just had to look for it. So you can't blame us for, how you got harmed by the vaccination. Still safe and effective, though. Disclaimer.
But I don't know what the answer is.
My second question has to do with the slide you have on the Liberal government platform, 3 points that it had on there. And my question to you about that, is that the current Liberal platform?
I downloaded that today.
You don't know if that's the current
That's
platform?
today.
That's today.
Today. That's up there. You can look that up under platform re-election, I think it is, something like that. Yeah.
So today, I just want to make sure I've got this right. So today, the platform that the Liberals are running on is require that travelers must be vaccinated, ensure that vaccines are across the federal public service, and that Crown corporations and federally regulated workplaces will ensure that vaccines are prioritized. That is still their platform today.
A re-elected.
That's so 2023. This was long after COVID, long after the Delta virus, long after all the, variants that they're trying to scare people. Even after all that, as things are starting to get back to normal, they still were promoting this. At a point when they were trying to still gaslight people that we didn't restrict people, we didn't cause mandates, we didn't force people to get injections. But if you want to board a train, you want to take a flight somewhere, you want to go on a cruise, you want to go travel within the country, you want anything to do with life, we recommend you get injected. But we're not forcing people. We're not forcing people. Because God knows that if we tell people that we're forcing you, that makes us more sound tyrannical, and people might think of us as some sort of fascist ploy and maybe overturn this government. Oh, we can't have that. Can't have that. Think of the LGBTQ out there. Think of all the indigenous people that we ignore. How are they going to feel if the Liberal Party gets overturned? That was still on their website in 2023, ladies and gentlemen. Even after the roller coaster nightmare that was locking down and reopening, then locking down, then doing this. And then they want to bring it back again. Which is just absolutely crazy. So, here's Ryan Gertson reminding us that the Globe should at least disclose where the doctor is still recommending this product gets their funding. Canada's health recommendations are controlled by these companies. Dangerous times. So, but anytime you see experts recommend or doctor recommends, just note. And he has a post underneath. It's a bit blurry, but it says here, yes, the Society of Obstetricians and Gynecologists of Canada have received funding from Pfizer. The great, powerful Pfizer mafia controls the obstetricians and gynecologists of Canada. So of course they're going to promote pregnant women to get the injection. Of course. Knowing that they had the information that caused spontaneous abortions. They're still going to promote it. For instance, Pfizer provided an unrestricted grant to support the development of the menopauseandyou.ca website, an initiative by the COGC aimed at providing information and resources related to menopause. Additionally, Pfizer has been involved in various partnerships and sponsorships within the Canadian healthcare sector. While specific details about ongoing collaborations with the COGC are not publicly disclosed, Pfizer's general support for medical associations and healthcare initiatives suggests a continued engagement in such partnerships. So, the health industry, your healthcare in Canada, is bought, corrupted, and controlled. That's why we're in a situation that we're in right now. That's why our healthcare that we used to pride ourselves, that Tommy Douglas at one point brought into this country that we take for granted, is crumbling. Because that same healthcare is corrupted by these institutions, by big pharmaceuticals, by the private insurance. They want to destroy it. They want to destroy this institution so that they can corrupt it for themselves. And bring on this tyranny, bring on these mandates. And people that tell me that, oh, well, you want government health care, you want the government to control health care in this country, my God, they're the ones that brought these mandates. The mandates were brought to you by the pharmaceutical industry that corrupted the government. So what we need to do is cut the corruption. We need to cut the corruption out of the healthcare industry, out of politicians, and actually focus back on to what makes this country, makes Canada, and reinstate proper basic health care for people. That your taxes go towards paying for that health care. You get basically a full public insurance for basic coverage. That's how it should be. And then if you want cosmetics, you want all that, then fine, go buy some private insurance. I don't care. But that was the staple of this country before it's been taken over. And again, no elbows up person ever talks about this. This is kind of a threat to society. This is kind of a threat to endangering people. So here's this is Dr. Jay Bhattacharya, the head of the CDC now, going to tell you how dangerous it is for pregnant women and why America went the direction they did in comparison to Canada that's continuing down the propaganda of big pharmaceuticals.
The consensus in favor of them. That was a lie. There was never a scientific consensus on almost any of the topics. And as you say, on masks, in fact, the pre-existing narrative, the pre-existing idea among most scientists before the pandemic was quite the opposite direction. What happened was a relatively small group, a cartel almost, of very powerful scientific bureaucrats took over the whole apparatus of science, at least as far as the public eye was concerned, dominated the media, dominated the message to politicians. And as a result, we had a catastrophic response to COVID. And we're going to be paying the cost of that for a very long time.
So it looks like Canada is going to continue down the mafia rabbit hole. As compared to America, that's actually correct about this. Despite all the flaws we could give about America, they're actually on the right side of this. But Canada, because we're so colluded into the elbows up, anything against America, America's so despicable that even when they do the right thing, we have to do the complete opposite. And the complete opposite is worse. The complete opposite is dangerous. That's what Dr. Jay Bhattacharya is saying. That the health industry in this country, the health industry in Canada and the United States and around the world is so corrupted that having articles like this, having articles discussing pregnant women still being injected, even with all the data analysis still out in the public in 2025, is still dangerous. And why are they pushing this so harshly? I thought we were done with COVID. I thought people don't want to talk about this. I still have people I know that keep telling me, Jason, don't talk about COVID anymore. I'm done with it. I don't want to talk about COVID. Well, guess what? Good timing. Good timing that COVID is surging again. COVID surge in India. Shangri-La reports first death. Mumbai sees 11 fresh cases daily. So, what goes around comes around, I guess. Oh, man. Good timing. Good timing to have all these articles come out, to be scared of the measles, to countries signing off their sovereignty to the WHO. Oh, now all of a sudden COVID came back. Look at that. A virus that's so smart, it knows exactly when to appear and disappear. How crazy that is. Nature, am I right? I'm sure it's from the bat market. This is City News, so a bit more local here. A new variant of COVID-19 may be driving up cases in some parts of the world. Who's saying that? The World Health Organization! The World Health Organization that just launched a new treaty that countries have been signing to give up their sovereignty to them. Now all of a sudden, oh, COVID's back. COVID's back, guys. Look at that. Look at that. Just coincidence. I guess Canada is going to have to, lock down again. I guess we're going to have to get everybody back to, digital currency and mass surveillance and mask up and mandate that they can't travel anywhere. Oh, I don't know what to do. It just happens. So this is what's happening, folks. They're never going to let this down, which is why I'm never going to let this down. And I know people get annoyed hearing about COVID because they want to move on from this. They want to pretend that didn't exist and want to get rid of it. But guess what? It's still continuing. It's still continuing. Why? Because the heinous powers of be use COVID and manufacture COVID for this intended reason, because they want dominant control over people. They want control over people. COVID was the perfect opportunity. Just like a terrorist attack, just like any huge worldwide catastrophic event is the perfect opportunity to seize control of people, to take nations for granted, seize over their power, seize over their territory, and master control of individual people, restrict their civil liberties, restrict their constitutional rights, everything possible. And now, because they're announcing COVID is returning and measles are happening and this and that and bird flu and all this craziness that's happening, we're going to leave it to the WEF. We're going to take our sovereignty, give it to the WEF because they know how to deal with pandemics. And who knows the WEF and WHO? Bill Gates. Gavi, which is Bill and Melinda Gates Foundation on vaccines. China, the military-industrial complex, like Raytheon, Boeing, Lockheed Martin, they're all part of this because they want control. They want to control you, and now is another opportunity for them to enact this power. And thank God this is coming on the whims, just as Canada, UK, and all these other great nations signed off their sovereignty to the WHO. Don't you feel like chumps now? Don't you feel like elbows up was a complete waste of time? Because you're so worried about Trump taking over Canada. Guess what? Canada's already been taken over, and it's going to get worse. And I don't see anyone standing up against this.